Hi, this is Dr. Beth Baldwin, and today I'll be walking you through how I interpret ZRT Laboratories' cardiometabolic profile. The cardiometabolic profile is a test that we conduct in dried blood spot, so it's convenient for patients to collect at home, and they just collect a couple drops of blood, mail it in to us, and we're able to help you utilize that as part of their screening and early detection for major indicators of metabolic syndrome, insulin resistance, and cardiovascular disease risk. So this is very appropriate for patients who might have dyslipidemias, hypertension, abdominal obesity, insulin resistance, as well as anybody with inflammatory issues or clotting problems. Just to tour you through the report, up on page 1 at the top left, you will see the report number, the evaluation number. This is the number you'll refer to when you call in to ZRT. If you want to consult with us on the clinical consulting team, we'll use this number so that we're all looking at the same report. And then over at the top right, I'm going to point out that you can see here when your patient collected their sample, date and time. And that becomes really relevant for this profile because we do strongly recommend that patients collect for this profile in a fasting state. We want them to have water only for 10 to 12 hours prior to collection, which is usually done first thing in the morning. If they are not fasting, it's going to drastically impact their insulin level. And if they come up with a high insulin, we will let you know in the comments that it's possible they were not fasting for the collection. And then moving down to the patient identifying information, we have their name, their contact information, gender, birth date, and menstrual information if applicable. And then if they provide it, we have their height, their weight, their waist circumference, and we calculate their BMI for you, which we're then able to incorporate into the comments section when we talk about the significance of the different markers that we look at. So going down to that fasting insulin as the first cardiometabolic marker on the profile, what we have here is a visual depiction of their levels with the slider bars, green indicating within normal range, yellow indicating high normal or low normal, and then red indicating out of range. But I do want to point out to you that on fasting insulin, there's a wide range of normal from 1 to 15 units per ml, and that is our green bar. However, there's a much narrower range that we call optimal, which is from 2 to 6, which we consider optimal for health. So when we comment in the comment section, we will talk about where insulin falls in terms of the normal range and also how it compares to what we consider the optimal range of 2 to 6. And then the next marker going down is the high sensitivity CRP, which is high sensitivity C-reactive protein, which is an inflammatory marker. It's an indicator and a contributor to pro-inflammatory and pro-thrombotic elements of cardiovascular disease. So high sensitivity CRP, when we are looking at it below in the range of 0 to 10, is specific to cardiovascular disease risk. Our normal range is less than 3. From 3.1 to 10, it signifies inflammation within the cardiovascular system, which is often part of the precipitating events of injuring, kind of micro injury to the endothelial wall. We have inflammation, we have depositing of cholesterol, we have development of foam cells, and then putting down of cholesterol and calcium, which eventually leads to the formation of atherosclerotic plaques and increases risk of future heart attacks, strokes, and peripheral artery disease. So CRP is our inflammatory marker. When it's elevated above 10, we're no longer thinking about it as an inflammatory marker for cardiovascular disease. We're thinking about it being more likely related to an acute inflammatory event, such as an infection or a trauma or an injury. Next on our profile is the hemoglobin A1C. This is a measure of glycosylation of red blood cells, so depositing of sugar onto red blood cells. Red blood cells turn over completely about every 3 months. So we consider hemoglobin A1C to be a marker of the average blood sugar that occurred over the past 3 months. Normal is stated in the reference range as less than 6. Technically, a normal hemoglobin A1C is less than 5.7%. 5.7 to 6.4% indicates prediabetes, and 6.5 and above is considered diagnostic for diabetes. Among our diabetes patients, we tend to measure hemoglobin A1C every 3 to 6 months, and our therapeutic goal is to keep them under a 7% hemoglobin A1C. Higher than that, like our patient here in the sample report, has an 8.8. That indicates a high risk of glycosylating proteins throughout the body, and that means microvasculature compromise, retinal problems, potential for kidney disease, stroke, peripheral artery disease, etc. So our therapeutic goal with diabetic patients is to remain below a 7 on hemoglobin A1C. Next up, we have fasting triglycerides. Fasting triglycerides reflect the storage of excess calories as sugar, 3 glycerides on an acyl backbone. We ideally want these to be below 150. Newer research is actually pointing to lower levels as ideal, possibly below 100, and some people are even aiming for 70. Higher triglycerides are associated with increased risk of heart disease and stroke, and are often found in untreated diabetes and in our patients who are obese. And then we have the rest of the lipid panel, the cholesterol, which is total cholesterol, HDL, which is our healthy cholesterol or high density lipoprotein. We want that to be in the higher range. It is protective for cardiovascular disease. LDL, which is the low density lipoprotein, we want to have less of it. It is less healthy. It is what some people call bad cholesterol. And then we have the VLDL, which is the very low density lipoprotein. And that's a marker of remnant lipoproteins that are significant in the development of atherosclerosis. Down at the bottom of this page, if the patient has reported any therapies that they're taking, we will display them there. And then moving down to the patient symptom survey, I want to point this out. We get a lot of questions about the patient symptom survey. Sometimes people wonder if this reflects anything about the lab results themselves. This is strictly information the patient reported to us. We've collated it into categories. We've indicated the severity, and this gives us a quick visual reference of what symptom categories are most problematic for them. And this also allows us to incorporate that information into the comments, which we will see down below. Lab comments will talk about their findings of their lab results, how it falls within the range, what that indicates for their health risks, and potentially some treatment considerations of how it could be modified. And that is our report. If you want to dig a little deeper into how we've developed these ranges, what we're looking for in terms of normals, and how these different markers impact health, you can access our provider data sheet on the cardiometabolic profile on our website. And you're also welcome to give us a call at 866-600-1636. Thanks for listening.